All right. Good afternoon, everyone, and welcome to this Measles 101 in just 10 minutes capsule. Today, we're going to be talking a little bit about measles data, what's the status right now here in our state and also nationally. And also, we're going to talk today what to do and how to get prepared if you are traveling or maybe if you are exposed, for example. Okay. So, remember, my name is Dr. Jeannette Lopez Bellin. I am one of the epidemiologists working with the City of Houston Health Department, and I basically work with infectious diseases. Okay, so for example, talking about the data, give me 1 second. I'm just trying to put up the slides. Okay. Here it is. Okay. All right. So let's begin. So, did you know that measles is one of the most contagious diseases in the world and it's reemerging? You sure do. Okay. Because we've been talking about this for a long time, but it's very important to reinforce this. Okay. Remember that measles was actually eradicated or declared eliminated in the year of 2000. And we're now seeing new cases for diverse reasons affecting mostly populations that are basically children and also immunocompromised populations and unvaccinated populations. Okay, so talking about that data, let's begin with United States, and this is basically as of May 16. So we have actually reported or we have confirmed 1,024 cases, and this is basically data coming from the CDC. And most of them, or 30%, actually 68% of them, they're basically falling under the children age and teenagers. Okay, remember that it's mostly affecting unvaccinated populations. So it's very important, guys, to know that vaccination status. Today we have some tips on how to do that, and also make sure that everybody surrounding you or just spread the word that everybody needs that. Okay, talking about Texas data. Remember that Texas is leading. Okay, remember that Texas is basically it was declared like the ground zero, specifically in the west side of Texas. It actually started by Gaines County, and then it slowly started like spreading over the other counties as well. And now we're seeing cases mostly spread through the Midwest, and we have a few outbreaks in the North Texas area. Okay, so as of now, and this is basically as of May 20. Okay, it was reported through the state database that we had confirmed 722 cases. Here in Harris County, Houston area, we had reported 3 cases, but from these 3 cases, they are not infectious anymore. So basically that means that we are not a little bit on danger, but remember that because this disease is highly transmissible and infectious, we should not let that guard down, and we can make sure to get that vaccination that we need, okay? So now what you can do, for example, to stop measles. Remember that measles, guys, we've been talking lately about this viral infection. We've been talking that we have vaccines available, that they were actually developed in the 1960s, actually, and we mostly need 2 doses of that MMR vaccine. That once again, it's actually it stands for measles, mumps, and rubella. Okay. So what can you do to stop the spread? The first thing you need to do is to check if you or your children are vaccinated. Okay, how you can do that? You can talk to your provider. You can actually consult or talk to the health department and ask them if you are actually good with your vaccine status, and if not, you can find ways with your private provider or maybe with the local health department to get those vaccines that you need. Okay, also encourage others to get vaccinated. Okay, so let's actually spread good information, and let's just allow everyone to get access to this, so everybody's vaccinated. Because remember, as much people is vaccinated, basically those people that are immune compromised, or maybe those infants that they cannot get the vaccine, they're going to be protected. Okay, that's called actually herd immunity, and basically that's gonna help us a lot. Okay, now if you have symptoms, let's say that you're actually suspecting that you might have measles. If you have symptoms, please stay home. Okay, remember that this is highly infectious and it's actually spread through the air. Okay, it's an airborne viral infection, and then you can actually expose other people. So first contact your doctor or talk to your doctor and then ask for the next steps. Okay, remember that there's not a cure for measles because it's a viral infection, so most of the treatment that are available are just supportive, and it's just no more to actually help with the symptoms. Okay, but if you were in contact with someone with measles, okay, so the first thing that you need to do is actually notify your health provider or the local health department and watch out for those symptoms. Okay, what are those symptoms? So basically, measles has a life or a window of infectious period for about 14 days. Okay, and this is actually the time that the person is actually infectious. But we're going to see a rash that is actually very, very particular to measles. That it's going to be starting at the level of your hair or your lyme hair, and then it's going to be spreading down. Okay, you're going to see also the coplic spots. Okay, so here I have one image showing that. Okay, so basically the coplic spots, if you're able to see the image, you see those tiny whitish dots in under the tongue. Those are coplic spots. They are very particular to the disease. We're going to see also high fever, and also if you know that somebody that you were exposed to tested positive for measles, just go ahead and stay home and follow all the precautions so you can help to stop the spreading of the infection. Okay, but now, do you know, for example, and this is new, I mean, this is news. Okay, this is actually something that it came in the titulars like yesterday. And then basically remember that if you're exposed right now, we have outbreaks, and this is nationally. So see right here, a lot of people that attended a concert, okay, and this was this past weekend on May 15th. New Jersey right now, it's stating or is warning the population about exposure if somebody attended Shakira's concert in New Jersey. Okay, so they actually were able to get somebody who tested positive, and now they're looking for people who might be related to this area, to this concert, to actually, get, the care that they need. I see one question right here coming from Suhaili. Are the warmer months good for the vaccine? Actually, you can get the vaccine whenever you can. Okay, so warmer weather or rainy weather or winter or something related is not going to affect. Okay, so basically remember that vaccines, they work with the immune system of the person. So what happens is that once you get the vaccine, this is basically an antigen. In other words, a foreign that is actually administered into your body, and then your body is going to generate an immune response to actually produce antibodies, so whenever you're exposed to the real infection or real virus, you don't get infected. And thank you for the question, because I think this is one of those misconceptions that are going around. So people think because it's raining, or maybe because they're having symptoms, as we mentioned in the past capsule, like for example a fever or maybe flu-like symptoms, they are not eligible to get the vaccine. And the third is that actually you can get that vaccine, okay, unless you have basically the ineligibility criteria, such as, for example, if it's an infant, that it has an age that it's lower than 6 months, or if it's a pregnant person, or if it's somebody who is immune compromised. So those patients or those populations, they're not actually able to get the vaccine. That's why it's important to get everyone prepared, okay, or everyone vaccinated. But now here we have some key recommendations. Now we're approaching summertime. A lot of you probably are thinking to travel out of the state or out of the country, or maybe to other cities within Texas. We know Texas is huge. Maybe you're thinking going, or you have family members living by West Texas, or maybe El Paso, which is another area where we have seen the cases increasing. So it's very important to plan before traveling, okay? Because this is going to be prevention, okay? So here we have some key recommendations before traveling. Make sure that you're vaccinated, that you're actually up to date with those vaccines. You're going to require, actually, you require 2 MMR doses. And then if not, you can go ahead, because we're in an outbreak, you can go ahead and get that actually that vaccine that you need. Now, during the trip, okay, so avoid big crowds. Also, avoid any spaces or areas where people are just congregating. Okay, if you are exposed to someone, or if you see like people like acting differently, or maybe they have like flu-like symptoms, wear a mask, because that could help. Now, after the trip, okay, so make sure and monitor the symptoms that we just mentioned earlier. If there's any of these symptoms, please go ahead and call your healthcare provider and talk to them about this, okay? And what would happen if you're planning to attend a concert or maybe a baseball game or something like that? Same things apply. Okay, so make sure that you have the vaccines. Okay, make sure to monitor those symptoms. And then if you're exposed, and then basically if you have the vaccine, you're going to be all right, basically, because the vaccine has a coverage of 93% if you get one dose and 97% if you have the two doses. Okay, if not, monitor those symptoms and then stay home, protect everyone. Remember that basically prevention, it's health, and it's better to actually, be prepared than actually get sick. Okay, so if you don't have any questions, that will be everything for today for these 10 minutes. Thank you so much for joining and for the questions. See you next time. Have a good day.